Hello and a very warm welcome to another special edition of Middle East Matters, bringing you the latest news on the coronavirus crisis in the region. Coming up on our program this week, in Iran, officials claim the daily death toll has stayed below 100 since mid-April. We'll be speaking to a doctor on the front lines of the pandemic. Navigating pregnancy in the times of a health crisis, one medical center in Tel Aviv is taking care of mothers-to-be who have been considered a high-risk group for other respiratory illnesses. Also coming up, a Hollywood artist tutors Arabic-speaking children during the pandemic. We bring you a report on a new YouTube channel launched from Los Angeles. Thank you for watching Middle East Matters this week. We start with Iran, one of the worst hit countries in the Middle East, where authorities have reported under 7,000 deaths. Observers and health experts say in reality those numbers are considerably higher. Now, some blame sanctions for the magnitude of this crisis. Others believe this is because of mismanagement and a lack of transparency. Now, after weighing up economic risks against health ones, the country's leadership decided to reopen for business in late April, and then came the reopening of schools and mosques earlier this week, raising further concerns about a second wave of infections. Now, for more on this story, I'd like to welcome a doctor from Tehran who has been on the front lines of the battle against COVID-19. He has actually asked for his identity not to be revealed. Thank you so much for being with us. Now, in your experience, how did Iran deal with this crisis from the outset?
I think the Iranian coronavirus response was one of the worst. We were one of the few countries that maintained direct flights to China until the very last moment. I believe there were hundreds of Chinese clerical scholars in Iran who were still travelling back and forth to their country, China, during this period. There was also a great deal of pressure in the lead up to the annual rally celebrating the anniversary of the Islamic Revolution in February and the parliamentary election that followed. Medical staff were urged not to use masks or shields so they wouldn't alarm the population. And once the arrival of the disease was finally announced, people weren't taking the right measures because in the first 2 to 3 weeks they said that COVID-19 was just a common virus, like a common cold. All of this led to a spike in the number of infections. Also, the numbers that were being announced on the radio and TV were much lower than what we were dealing with. In my experience, it was 4 to 5 times more than what was announced, but TV outlets insisted that numbers were low, so people weren't taking it very seriously.
Now, you just mentioned that in reality, in your experience, the numbers have been higher than what the authorities have been announcing. Tell us about some cases that you dealt with where you believe that the patient died from the virus, but the death certificate stated something rather different.
One of the reasons that the death toll in Iran is relatively low is that we had patients who had very clear symptoms linked with the disease. We also used CT scans to check for COVID-19 infections. But because the testing kits that we used did not correspond with international standards, the results would come back as a false negative. So the Ministry of Health decided to dismiss coronavirus as a reason of death for these patients. I myself had a private patient. He had previously had a kidney transplant. He contracted the virus and died in ICU. When his family wanted to collect his body, authorities said they would only release it under the condition that they state kidney failure on the death certificate, which was the underlying health issue. I believe there are very few doctors across Iran that haven't dealt with similar cases.
Can you now tell us about the shortages of equipment that you've experienced on the front lines, which has actually been very much a global issue?
During the first month, we had a real shortage of masks. Prices were low at the time, so people were bulk buying, and we ran out. As for testing kits, many were faulty. The majority of the results were false negative, even if the patient was showing highly suspicious coronavirus symptoms. These kits weren't very trustworthy. As for the respiratory protective devices, when we had a high number of cases at the beginning, there were especially shortages in smaller towns and cities. But we're okay at the moment. Those shortages have been addressed over the past 2 to 3 weeks.
Of course, another rather alarming problem in Iran is that some pharmacies do give out medication without prescription, which can be dangerous when dealing with, let's say, hydroxychloroquine, a medication that, despite really scattered evidence, is being used in some countries to treat the coronavirus.
Indeed, Iran is one of the few countries where it's possible to obtain drugs without a prescription. So at the beginning, we actually had a shortage of hydroxychloroquine. People were self-administering it in high numbers, while it's something that needs to be supervised by medical professionals. We've since heard about several cases from colleagues of people developing heart complications, experiencing blurred vision, and this isn't a new problem in Iran.
Doctor, as I mentioned earlier, with the number of cases decreasing in Iran reportedly, authorities have had to weigh up health risks against economic risks, and so they have been opening up. Are there concerns about a second wave being potentially more aggressive?
Unfortunately, quarantine was lifted across Iran quite drastically, officially and unofficially. Employees had to go back to work. I guess in Tehran, around 70% of them are back now. So it's likely that we will see a stronger wave of the virus, with a higher death toll, as it will be transmitted from person to person. You can't put the economy before science.
It does sound like Iran has to brace itself for the second wave of the coronavirus in the coming months, in autumn more specifically. Doctor, I'd like to thank you for speaking to us here on Middle East Matters.